Coronavirus is a large family of viruses called coronaviruses, and these have been there for long, and they cause diseases in both human beings and animals. In human beings, several coronaviruses cause several illnesses, with some mild like common colds and other severe illnesses. The most recently discovered coronavirus is the one we are calling COVID-19, and it is now responsible for now what we are calling coronavirus disease. The symptoms generally are fever, tiredness, and dry cough, and these are usually mild. But some patients may develop aches, pains, nasal congestion, runny nose, sore throat, and some diarrhea. In 80% of clients, they usually have mild disease, and this might resolve on its own even without serious medical intervention. But 1 out of 6 patients might develop serious illness, which may cause difficulty in breathing, which now calls for medical intervention. Generally, this problem is more severe in older people or people who have chronic illnesses like hypertension, diabetes, heart problems. And from the statistics we have, is about 2% of the people right now who have been affected by this coronavirus disease have died. So you can see from the statistics is that it's only a small percentage. It's not as virulent as a disease like Ebola. The virus spreads from person to person, and it is mainly if a person near you is sneezing on objects, and then you hold the object, and then you touch your eyes or your nose or your mouth. It also can be spread if you inhale droplets which a person who is already sick has exhaled or has sneezed into the environment. And the incubation period in this matter is the period between when you get the infection and when we start seeing clear signs and symptoms. Generally, the incubation period as of now is known to be between 1 and 14 days. I should also make it clear that people should have good respiratory hygiene. So for example, if you are coughing or sneezing in public, you should sneeze into your folded arm like this, or sneeze into a serviette or a handkerchief so that you don't spread the same. And generally, if you have fever, difficulties in breathing, you should seek medical advice. So should everyone have a mask? No. Masks generally are recommended for clients or patients who already have the problem, or medical personnel who are handling this kind of patients, or a person who is assisting at home a patient who already have signs and symptoms. The county government of Nakuru is educating the public on coronavirus so that they know what is it. And 2, we are giving the public information on how to prevent themselves from getting this disease in case it ever comes around. And then we've put in together a surveillance team and a response team in case we have any reports of any presence of such an incident anywhere. And we have also procured PPEs, personal protection equipment, and they are ready for use by our health personnel in case we get a client. We have also trained about 200 health personnel, that is at the Provincial General Hospital in Nakuru, at Naivasha, and Gilgil Hospital. So we have a complement of 200 personnel of all cadres. And finally, we have identified an isolated treatment facility in case there is need for such.